Hello, I'm Dr. Sushma Harish. Fibroid is a non-cancerous growth of the uterus. Most of the women do conceive with fibroid uterus, but it also depends on the location and size of the fibroid. If it is a submucosal fibroid, it will distort the uterine cavity and prevent implantation of the embryo. Or else if it is blocking the tube or ascent of the sperm, also causes infertility where the egg cannot meet the sperm. So if the size of the fibroid is more than 4 cm or if it is submucosal fibroid or intramural fibroid and causing recurrent miscarriage, fibroid may have to be removed. Based on the location, it is submucosal fibroid, intramural and subserous fibroid. Usually submucosal fibroid is within the cavity of the uterus, will distort the shape of the uterus and will interfere with pregnancy. And also sometimes the large intramural fibroid also interfere with pregnancy, and when there is big fibroid sitting in the lower end of the cervix also hamper sperm to ascent above. So it is usually the submucosal fibroid and intramural fibroid which will interfere in conceiving, and the subserosal fibroid usually doesn't cause any problem. When there is recurrent pregnancy loss, recurrent miscarriage or recurrent IVF failure, or when the fibroid, submucosal fibroid or intramural fibroid more than 4 cm distorting the endometrial cavity, or the woman is having symptoms like heavy menstrual bleeding or painful periods, or when there is a large cervical fibroid which will distort the cavity again, which will help cause problem in sperm ascent, those fibroids has to be removed. Laparoscopy is a keyhole surgery where smaller instruments are used with more precision, small incision and faster recovery. When through laparoscopy we will make a cut over the uterus, fibroids are removed and then the uterus are sutured for the strength. Now the fibroid removal using laparoscopy has becoming painless, faster recovery and cosmetically a better surgery. Usually we'll recommend a gap of 3 to 6 months for the uterine incision to heal before planning for pregnancy. Definitely after fibroid surgery, pregnancy has to be closely monitored because there will be incision over the uterus. So close monitoring and close fetal monitoring is very important following fibroid removal surgery. Unfortunately, yes, especially when you are younger age and multiple fibroids do reoccur after surgery but over a period of time. But pregnancy will keep the hormone level low and decrease and helps in reducing the growth of the fibroid, and also during lactation also the estrogen level will be kept down and the fibroid growth will be in halt.